Population Assessment and Service Learning Project poster involving the Food Bank of Western New York by Christina Lupo, Crystal McGuire, and Corey Beniak. The mission and vision for the Food Bank of Western New York starts with the mission. It is to obtain nutritious food and support from public and private sources and efficiently distribute these resources to the hungry in Western New York through our member agencies, which there are 329. The vision is to respectfully provide food, training, education, and hunger advocacy for our member agencies and their clients. Volunteers with the Food Bank of Western New York may assist with sorting and boxing donated food for distribution at local pantries within surrounding communities, clerical work in office, such as copying and faxing. And the purpose of this activity, or these activities, is to equally benefit both provider and recipient through exchange of education and societal need. The service site census data includes data from Buffalo, New York. The total population is approximately 258,066. Ages 0 through 9 take up 13% of the population, along with 10 to 19 and 20 to 29 take up 19%, 30 to 39 13%, 40 to 49 11%, 50 to 59 13%, 60 to 69 10%, 70 to 79 5%, and 80 and above 3%. 52% of the population in this area are males, while 48% are females. 31%, only 31% of the population are married, 82.7% in ages 5 and older, or 25 and older, have a high school diploma or higher, and 24.6 have their bachelor's degree or higher. Languages, ages 5 through 17, English is spoken in 75% of the homes, 12% Spanish, Indo-European 5%, Asian Islander 6%, and all other languages 2% of homes. Ages 18 and older speak English in 84% of their homes, 7% Spanish, 4% Indo-European, and 3% Asian Islander, and then 1% in any other language. Census data continued. 59.2% of the population of 16 years or older are in the civil labor force. Poverty status is 31.4%. Median monthly cost of owning a house with mortgage $949, without a mortgage $382, and the cost of rent averaging $699. The average household income is $31,900, and 97.2% of children less than 19 are covered with health insurance, and 91.7% of adults 18 to 64 are covered with health insurance. The air quality for the service site area in Buffalo has a reading of good as of May 8th of 2017 and May 9th of 2017. The index for May 8th is 43 and May 9th is 41. There are no health messages, and all AQI pollution details read good as well, with the ozone reading at 43 and particles of 14 for May 8th, and the ozone reading 41 and particles of 30 for May 9th. The water supply received no violations for the parameters referenced in 2016. The water source is from Lake Erie, and there are no current reportable contaminants or threats to this water supply as of May 9th, 2017. Top 5 leading causes of death reported. Number 1, cancer. 2, heart disease. 3, unintentional injury. 4, chronic lower respiratory distress. And 5, diabetes. The infant mortality rate is significantly higher in Erie County compared to New York State. In 2014, the infant mortality rate was 4.5% and has been steadily decreasing in New York State. In 2014, the infant mortality rate in Erie County was 8%, showing a need for improvement in Erie County. Regarding sexually transmitted diseases for the area, in all of New York State, to begin, 98,262 cases of chlamydia were reported. In Erie County, there were 5,005, and there were 1,155 cases of gonorrhea in Erie County, with a total of 20 2,600 cases in New York State. Syphilis reports included 64 cases of early versus 64 cases of late syphilis, compared to 4,005 early and 3,047 late cases in New York State. The AIDS frequency was 42 in Erie County, compared to a total of 1,639 cases in New York State, and the rate of AIDS has declined in the region and state. That's good. Gonorrhea's rate had a slight increase in Erie County, but stayed mainly the same. And chlamydia has been steadily increasing in Erie County, and syphilis cases have increased by almost 20 new cases a year. A few public health core function and essential services related to this activity is to focus on the entire population, reflect on community priorities and needs, establish caring relationships with the communities, families, individuals, and the systems that comprise the population community health nurses serve. Stay grounded in social justices, compassion, sensitivity to diversity, and respect the worth of all people. Encompass the mental, physical, emotional, social, spiritual, and environmental aspects of health, and collaborate with community resources. So what we're asking ourselves here is, are we actually improving health during these times of service activities? In a recent study, the current evidence suggests that the dietary intake of most food pantry users does not meet recommendations. Future research should draw more representative samples and investigate the impact of food pantries on users' diets. However, food banks serve as a valuable resource to lessen hunger in communities facing food insecurity or instability. By making access to more fresh fruits and vegetables and nutrition education, such as recipe tips for using good food demonstrations and promoting increased physical activity, has proven to be beneficial, just hard to maintain. And that is something that the Food Bank of Western New York has been trying to implement. So community nursing diagnosis based on the research, increased syphilis cases in Erie County, 5.5 cases per 100,000 residents related to higher population concentration, and in a decreased percentage of marriage rate as well. Areas with an increased population had an increase in the incidence of syphilis, as manifested by the distribution of cases of syphilis, compared to 3.7 cases per 100,000 in the Western New York region as a whole. The levels of prevention applicable here actually do fit and can be considered for all three levels of prevention, and here's why. Primary, a member of the community whom is aware of the food bank and associated pantries loses their job. Before they go hungry, they can replenish their cupboards utilizing food bank or food pantry and obtain additional resources. Secondary example, a teacher notices a child is coming to school hungry often. Further inquiry leads to the discovery that the mother has language barrier and was not aware of services such as the food bank or pantry, and teacher refers with instructions in Spanish. Tertiary example of prevention. Depending on the severity of the before-mentioned child's nutritional status, they may be included here. However, more fitting would be an example of an elderly man. He's hospitalized for injury and decomposing health directly related to malnutrition from poverty status. And after being treated, he is educated and shown how to access food bank or food pantry resources. Lastly, we have a few improvement ideas. In the future, to improve the service activity relative to the population served, we could advocate for health training of food pantry workers with direct client contact to make sure they are getting that nutritional education. We can continue to offer our volunteer services at least once a month, if feasible, to our schedules. We can recruit, advertise for additional volunteers, since volunteering is a crucial part of the food bank running. We can utilize social media, any kind of social media outlet is helpful. And we could recommend the distribution of the printout charts to the community in multiple languages, since we have several here in Buffalo, containing the true expiration dates for labeled foods provided by the most recent evidence-based research. Because a majority of canned goods and dry goods, jarred goods, they last longer than the labeled dates. Please observe references and thank you for viewing.